Hi everybody, my name is Matt Ostroff. I'm an advanced nurse practitioner in vascular access working at a major trauma center in New Jersey. The media has covered a lot of information about infection prevention with the COVID virus in the hospitals, and I'd like to share some information to other providers, physicians and vascular access specialists that are putting in central line catheters. With the growing number of patients that are now intubated in the intensive care unit, what we're doing in most hospitals is running our IV tubing, our medication, from outside the rooms over great distances to the patient's bedside. This opens up a risk for catheter dislodgement. Catheter dislodgement would equal the physician or the practitioner going back into the room, another exposure, placing another line, and the associated risks with the line placement. I think it's imperative in a situation like this that we take product endorsement off the table and look at what products work. There is no question in my mind that using a subdermal securement device, and that there only happens to be one on the market, such as SecurAcath, is imperative to secure our lines. The last thing you need is an isolated patient to lose their central access, their one means for getting their medication, and then having to go back in the room and risk exposure to your clinician. So I highly recommend this device. It's a subdermal securement device. This is what it looks like. It's very simple. It's a device that goes on the end of the catheter. It has two prongs that open up under the skin, and it secures the device as if it's anchored in there, okay? The reason that this is better than sutures, because sutures would secure the device as well, is that when you go to change the dressing, you're able to turn the catheter up and clean underneath. With these patients that are going to be there a minimum of 2 weeks fighting this virus, and those that are intubated probably longer, the risk of central line infection is exponentially dangerous, and we have to prevent it with any means that we can. So again, with the new treatment modality of treating patients from outside of the room with their IV catheters, their central line catheters, we must secure those lines. So I implore you, the company is now providing free SecurAcath for you to do your initial assessment of the product. Put these on your catheters, notice that there's no dislodgement, and then continue to use these for your IV, for your ICU patients. I guarantee you that the safety of these is worth every penny. Thank you.